All right, so INS standards recommend starting in the forearm, and you want to be at least 2 inches above his wrist. So one thing you can do is you can start at the AC, and you're obviously going to find some vessels, work your way down, but ideally kind of want to find the lowest spot feasible and select my site. So if you don't see anything in the forearm, look at the other forearm, and you can see the slide on site selection to get further details on that. But we'll go ahead and look at the screen, and I'll show you what I see. Okay, so what we see here is a beautiful right cephalic. So tracking it down towards the wrist, getting a good spot. I can see that the pathway is nice and straight, the vessel size is nice and big, and there's no clots that I can determine here, and this is what it looks like at the antecubital area. So I've got a good idea where I want to stick. So what you can do at this point is you can mark the arm with a skin marker, or you can just get a good idea in your mind on where that vessel is. Okay, so at this point I removed the tourniquet, performed hand hygiene, and cleaning off the gel over here. So what I'm going to do is clean the site with chlorhexidine. Recommend using the 3 ml chlorhexidine. They offer a larger coverage here than the ones that come in the kit. So we're going to give ourselves a nice large area. All right, so before we place an ultrasound guided IV, we need to apply a sterile probe cover. So I like to utilize, first clean the probe with an approved cleaner, and then we're going to go ahead and put some gel on there to help with the image. And then we're going to open our probe cover sterilely. Depending on your ultrasound, you may be able to utilize the smaller tegaderms, but for this one in particular, it's a little bit easier to use this tegaderm. So you're going to take it end to end and go ahead and just push down, apply it, squeeze the edges. Also note the Prezi slide where we talk about how these are not FDA approved, but this is kind of what we're using at the moment. We are in the process of switching to an FDA approved probe cover. More information to be provided here. So at this point, I want to assure that nothing is touching the top of the probe. So unless I have sterile gloves, I don't want to take the top of it and make sure that the image is clear. I want to kind of put it on appropriately so that the image is clear to begin with. So now I'm going to go ahead and, all right, so once I have my probe in position, I'm going to go ahead and get my needle ready to go. One thing that I like to do is I like to utilize my pinky so that I have some contact with the patient's arm. So I've got 2 fingers over here kind of supporting the weight of the probe, and then I've got my pinky so that because basically what I don't want is I don't want my hand kind of up in the air shaking. I want to have some contact here. So you can see the depth chart that I've included to see if you can get by with a 30 degree or with a 45 degree. So I'm going to stick with a 45 degree. So you'll see the video of me sticking with the Phantom, but how it's going to look here is basically I'm going to go ahead and stick. I'm going to advance my probe back. I'm going to advance the needle, advance the probe, advance the needle, advance the probe. As I get into the vein, you're going to see me flatten out, advance the probe, advance the needle, advance the probe, advance the needle, and at that point you can probably thread the catheter off. But one thing to consider is that this probe sees like a sheet of paper. So if you don't want to go past that sheet of paper there. So as soon as you see the dot on the screen, you're moving. You see the dot, move. See the dot, move. That dot on the screen shouldn't be something that you see constantly. It should be something that disappears. But something to just gather from this is that it is a fluid concept here. So Now I'm not just advancing the needle and keeping this stationary. I'm moving, 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 moving. So basically what I'm looking for is that I see a bright dot right above the vessel there, hopefully not going past it to the side and not going through it. So go ahead and stick. All right, so I go ahead and I see my that bright dot all the way at the top. So I'm going to go ahead and advance my probe, advance my needle, advance my probe, advance my needle. So I'm tenting right now, potentially maybe even in the vessel. I want to advance my probe till that dot disappears, advance the needle, advance the probe, needle, probe, needle, probe, needle, probe, needle, probe. And realistically, I'm gonna do this until one, I feel like I can't walk it up, or maybe the patient is starting to move a little bit. So at this point, the entire catheter, the entire needle is in the vein, and I'm going to go ahead and thread off the catheter. Okay, so I've advanced my needle. I walked up my needle the entire way, and then I went ahead and threaded off the catheter a little bit so that the needle is not at the end of the catheter here. So one thing to keep in mind is aseptic non-touch technique. So the insertion site is a key site there. So I do not want to, I'm currently wearing clean gloves, so I want to not touch that insertion site with my clean gloves. So one thing I do when I open up the IV start kit is I like to try not to touch the 2 gauze pads that are in there. So as best as I can, I want to try to place one over the insertion site, and I like to place one underneath. One, so that when I'm attaching the J-loop, I'm not touching the key site, and 2, it helps with containing the blood that will inevitably come out. So disclaimer, you can use whatever sort of method you would like as long as you are not touching any of the key sites. I find that this method works for me. So one thing that I like to do is I like to take the end of the J-loop here, and I like to attach it to the catheter hub so it is nice and secure and there's no risk for the catheter dislodging. I'm going to go ahead and pull out the catheter, and notice that I'm applying pressure right here, and as soon as the safety activates right here, it might have a drop of blood, but I'm inserting that right away. So you could do some variation of holding pressure on the vein. Sometimes these veins are so deep that manual pressure can be difficult, but it is possible. But this is one method that I like, and I've already got some gauze here. I can go ahead and get a nice seal on the J-loop. There might be a drop or 2 of blood. I can kind of utilize the gauze that are already here to assure that all the gel is gone, and I maintained aseptic non-touch technique. So at this point, I'm going to go ahead and draw back, make sure that there's blood return, and I'm also going to go ahead and flush. There are some portions of the video where I talk about how you can use a longitudinal view to make sure that the catheter is in the vein. You can go ahead and flush some saline and see some bubbles there, but you can see the presentation for that material.